using the following, will be given 5 minutes to pitch their business, followed by 5 minutes of Q&A from the audience. 30 seconds before the end of 5 minutes, you will hear a bell like this. So founders, please take note. The 9 companies are from 2 distinct groups and will pitch in the following order. First, starting with AI-based diagnostics. And first in line, we have BioMind, followed by Chronic Care, Meadow AI, Origin Health, Creative, followed by a 5-minute break before we embark on the next group, Personalized Healthcare. And first in line for that group is BioRim, Kinexis, Osteopore, and last but not least, Imagine Labs. Daria, you're on mute.
Thanks, Jeremy. We also would like to thank our partners from Russia that were engaged in preparation for this session and joined us today. So today we have with us representatives from various areas of healthcare ecosystem in Russia. This includes experts from public and private healthcare, innovation and technology builders, investment companies that focus on medtech and health tech, and more. After this session, we will help to organize one-on-one discussions between Singapore MedTechs and Russian organizations to explore possible collaborations.
And first up, we would like to welcome BioMind.
Hello. Hi, thanks, Jeremy.
Yes.
Could you hear me loud and clear, right?
Yes, great.
Right.
So Raymond,
Let me
take it away.
Yeah, could you enable my screen sharing, please? Hello. Screen sharing. Hi, Jeremy. Could you help to? I can't share my screen actually. I think the settings has to be activated.
Okay. Try now.
All right. Okay. Thank you. Hi, can everyone see my screen?
Yes, great.
Yes. Good morning, everyone, and afternoon to our fellow friends in Singapore. Very excited to be the first to speak for BioMind. All right, and just a quick intro about our company. We are a artificial intelligence company, and we specialize in using advanced AI techniques like deep learning to help physicians to diagnose and to treat conditions, medical conditions. So actually, we have a lot of awards and publications about our company, and we do achieve quite a number of awards over here. Okay, both at national level, regional level. Okay, and internationally, we are also sitting on the WHO and ITU AI Standard Committee. So we are leading the setting of the AI standard for radiotherapy, and also has been an active speaker in this group as well. Okay, we have a couple of office in Europe, in Beijing, and of course in Singapore. Okay, with close to 200 employees globally, we have close to 50% of them being in-house medical machine learning engineers. And we are also the only Singapore company to have forged an alliance with MIT CSIL. And you all know, I mean, for those who are familiar in the AI space, MIT CSIL is the oldest AI laboratory in the world since 1950s. Okay, so this is to introduce our flagship product. Okay, we use deep learning, machine learning applications to diagnose neurological disorders. So anything to do with the brain, we are here. All right. So this product, BioMind for the brain diagnosis, has been developed by close to 100 brain specialists and deep learning experts. Okay. So we use AI to analyze modalities like CT, MRI, CTA, MRA. Okay, for a wide variety of conditions. So what it basically does is that this application, first of all, you will be able to detect anomalies. Okay, and you will segment out all these lesions and anomalies on each and every slice of the scans. Okay, and then it does the prediction. So it will then be able to diagnose what specific brain condition that is. Okay, and then it also specifically pinpoint the specific location where the anomaly resides in the brain anatomy, and it generates a report automatically as well. So this is how the report looks like, and you can see there's a lot of information here. All right, the location where the anomaly lies, the signals, the uniformity, the boundaries, the severity, and all these contents are 100% automated using machine learning, so that physicians or radiologists, they no longer have to type it out. That helps to save a lot of time. And for this solution, it covers a wide spread of brain disorders, okay, close to 27 types of brain tumors, vascular diseases, stroke conditions, and the subtypes across these modalities. And our company have achieved the world's most certified medical device certifications as an AI product, and that includes Europe CE mark. At the beginning of the year, because of this COVID-19 pandemic, we extend our solution to also use AI to detect COVID-19 pneumonia on CT scans. Why do we do that? Because the traditional PCR test has inconsistent results. In fact, quite a number of times, a suspected patient, okay, would have seen multiple false negatives before it turns positive. But when we use AI and we apply on CT scan, we realize that the results are very consistently high in terms of both sensitivity and specificity. And very interestingly is that because the needs of the radiologist is they must be able to also differentiate COVID-19 from the non-COVID pneumonias, because that results in different kinds of intervention measures. Okay, and our solution has been proven to be more accurate, okay, than a thoracic radiologist based on multiple clinical trials. And in the case of pandemic management, it is important to do a rapid triaging. So this is when AI can really help to prioritize cases automatically. Okay, and very importantly is there is a strong need, okay, for doctors to compare and contrast multiple scans of the same patients to track the progression of disease. So this is where our AI comes in to do this automation of this comparative analysis across sequential scans. And we have deployed in a lot of hospitals worldwide, close to 140 hospitals, okay, from Asia Pacific to Europe, as well as Middle East. Also a lot of media reports about our launch of AI solution, okay, how we can actually help to intervene, you know, when it comes to pandemic management. And to summarize, our solution is easily deployed in hospitals. So how we do it is that we connect our systems to the PACS server, okay, so that as soon as the images are being scanned, okay, and then they are fed from the PACS server, the hospital's PACS database, to our system. So this is where our system will do the predictions, and it will generate the report and the results for the radiologist to do a review. And once it is confirmed, it goes back to the same database. So it's actually a closed loop process. And the end-to-end process takes only a couple of seconds instead of the usual half an hour to 1 hour, depending on how complicated the condition is. And that actually allows more patients to be evaluated. Okay, and the urgent cases are also flagged out so that you can ensure in the utilization of the resources optimally. Okay, and equally importantly is that with the use of our solution, it helps to mitigate or reduce blind spots or misdiagnosis significantly. Thank you.
Okay, Raymond, thank you very much. So now we would like to open the floor for questions.
Sure.
Daria, you're on mute.
Anyone from the audience wants to start with the question?
Yeah, so it's Alexander from RBB Capital. So in terms of the value proposition, so what do you propose as a value for the customer, and who actually will be the customer? So I see these approaches could be used in clinics, in clinical trials. So how do you envision this? Okay,
our intended users are radiologists, okay, and our solution helps to enhance their diagnosis as well as the workflow. because a lot of times, when doctors, they diagnose, it is based on a couple of factors that's not obvious to them. So that results in a lot of blind spots. Okay, so take for example, in the case of diagnosing brain tumors, okay, there is a very high chance that they might get it wrong, okay, because it's a very complicated task to do a differential diagnosis. Okay, but for our machine, because it has been trained, using so many cases in the past, okay, and they have been confirmed by the biopsy results as the ground truth. So that itself helps to enhance their diagnosis accuracy. And with the intervention of AI, okay, it not only helps to enhance the diagnosis, but it helps to automate the process of writing a report. That also helps to ensure there's a consistency in the report writing. And interestingly, some of our applications has also been applied in the surgical space because we are very good at segmenting. That means we are able to draw contours around, for example, the brain tumors or the vascular conditions, and that is needed, to do a precise surgery. All right. So we're offering this solution, okay, in summary, increasing the diagnosis accuracy, shortening the turnaround time for diagnosis to happen. Okay, and it allows precision in terms of the conditions segmentation, which can further help in the treatment process.
Right, I got it. And I actually have another question. So what would be your differentiation against, like, there are several competitors, like I have in mind something like Ecometrics. Probably there are others, I just don't recall them. But can you like set up a point of differentiation?
Right. So the thing is that we not only just detect anomalies, so we actually do a differential diagnosis. And that is very difficult to do because we must ensure that there is a significant, big number of data available, okay, which has all been confirmed by the ground truth or the correct answer before we train the machine. And that's the reason why, in terms of the way we are being certified, we are being certified to be able to perform diagnosis, not just to do a pure screening. And take, for example, in the case of the COVID-19 detection tool. So it's very clear, for example, because we are certified by the Singapore HSA, so the scope is very clear. Okay, we are also able to differentiate COVID-19 from other kinds of pneumonia. Okay, so it means that it is not just able to help to detect, okay, not just able to help to manage the COVID patients, but when it's able to differentiate other kinds of pneumonia, it means that it is performing a diagnosis. All right. So some of these companies, they will probably be able to mark out lesions, okay, or they can say that they are doing a screening, but they're not able to do beyond that. But in this case, what we are doing actually over here is that we are helping the doctors to perform diagnosis better.
Okay, got it.
Hi, Ray. This is Dmitry Alpin from Russian venture company. My question is related to your sales distribution model. You are selling directly to the hospitals, right? Using your own sales force. And if we're talking about the international expansion, how would you do that to ensure that your product at every hospital in the world?
Right. So we leverage on our distributors, and our sales managers will manage the distributors. Okay, and we are happy to find not only distributors but also various form of partnership models. Okay, take for example, because I do understand that some countries, they have big market players for medical diagnostic centers chain. So they also want to deploy our solution in order to gain the market share. And we are also partnering with PACS companies, because PACS companies, they also want to do a bundling of our solution. And very interestingly, recently we have a partnership with a European teleradiology company. So that actually helps them to differentiate their services from other teleradiology companies, because there's also an increasing trend of hospitals outsourcing medical images to teleradiology companies. Okay, and we are happy to also therefore partner with the traditional distributors who wants to purchase our system and mark up and sell to the hospitals. So generally speaking, we don't really go through hospitals directly. We go through middlemen, either intermediaries or distributors or some of those partners that I just mentioned.
Right. Okay. Thank you, Raymond. I think that's all we have for your pitch and Q&A today. Our friends from Russia, feel free to link up with Raymond directly after this. Next company we have is Chronic Care. Now, Ali, please take the stage.
Okay. Is my screen visible?
Yes. All right, Ali. Please.
Hi.
When you're ready.
Dobre utre, dama e gospoda. I hope I got that right.
Yes, that's right.
All right, thank you. Good morning to my colleagues, industry colleagues in Singapore. Actually, good afternoon to you guys in Singapore as well. So I'm Ali here. I'm going to be talking about how chronic care has revolutionized the assessment and management of chronic wounds through AI. These are some of our industry partners and early seed investors. Enterprise Singapore has been instrumental in our domestic and international expansion. And we've been working with Intel, one of our key partners. And in fact, if you go to our website, you will probably see a video that Intel had produced showing how we were the world's first to use the Intel RealSense cameras on a smartphone medical device and an Android application. Very interesting video as well. Okay, so what's happening with chronic wounds, globally speaking? Right now, a patient everywhere in the world is losing a limb, 30 seconds on average. And that directly affects the PEF, the physical, emotional, financial factor of the patient. $100 billion problem, globally speaking, and rising. And the disease by itself continues to rise, obviously because diabetes has been taking over a lot of people's underlying conditions. And it doesn't help that there's a shortage of over 7.9 million nurses. So what's happening with, what's our focus? We're trying to save one amputation at a time, and looking at Russia, there's estimated over 9 million diabetics in Russia and 4 million being diagnosed. That's a resounding 848,000 patients that would be suffering from chronic wounds, and a staggering amount of 216 million euros a year just for hospital stay to treat the chronic wounds. So an average hospital stay is about 15 days for a chronic wound patient. And obviously, how do we solve this? Is through early detection and proper treatment protocols. So if you treat a superficial ulcer, it costs 10 times less than treating a gangrene. So this is the current practice. Specialized wound nurse goes to the bedside of the patient, takes a probe, takes a marker, takes a tape, ruler tape, and measures, and then fills out a manual information. The documented error rate is over 44%, huge. And what we have done is we've miniaturized everything. We've taken away all this manual process, and we've made it totally non-invasive, where you can get the 3D wound measurement, the 7 tissue types, of course, the infection detection, undermining blood circulation problems, and inflammation. Over here, I'm going to just talk about one specific point over here, which is the upskilling of junior nurses. So a wound nurse is a specialist nurse, and by giving our technology to a junior nurse, she then becomes, the wound nurse becomes more accessible to more critical cases, thus making her a multiplier effect all over the country as a independent nurse if required to. All right, so what took 30 minutes has now gone down to 30 seconds. Time efficiency at its best. A very rich dashboard of information comes from this picture once it's captured. So you see the timeline of the wound, the size of the wound, and you also see the information which is inputted by the nurse and the AI comparison. So we keep both the sequence available for the medical practitioner to see what's happening. And this dashboard is accessible on any platform where you have a URL internet. So it's a URL link, which we assign you a login information specifically dedicated for the hospital. All right, so this is a good example of a wound that our AI picked up. The visual detection was, no, nothing's happening, but our AI said, no, there's something happening with this wound. And lo and behold, 1 month later, our AI was right, and it broke out into a wound. And again, same thing with ischemia. It detects the ischemia 1 month earlier, and it shows how imperative. Now, what's good over here is, if you see this patient over here, there's no visible signs of any problems of his foot. But once we did the multispectral scan on our device, we saw that there's a setup of infection going on, which obviously could lead towards amputation. Something like this is done at the bedside and not in an X-ray room. So there's no radiation, and it's easily accessible for the patients as well. We have a whole bunch of examples. Over here, there's a deep tissue injury, good for hospital liability, where an existing condition existed. And obviously, after 4 days, the wound broke out. So it's something that did not happen while he was admitted after in the hospital. So why did we do this? So when we approached the nurses, we asked them, well, there's a host of other devices out there. Why don't you use them? And they all came back with a resounding reply that, okay, they did not check all the boxes. And so hence, where we created our device, we got our patent, we were awarded a patent for checking all these areas where a nurse most requires our device in a chronic wound assessment situation. We were honored to be featured in this Smart Nation strategy book of Singapore, a directive for the Singapore Prime Minister himself. Okay, and this is our clinical validation showing that our device is obviously on tissue analysis and complication analysis better than manual records, and on par with manual size estimations. So we are strong in tech. We've got now 4 machine learning scientists, all from Singapore universities, and they're very eager and strong bunch of guys I'm delighted to work with, including our commercial team led by Ali, and Hussein being the CTO and the co-founder. Myself, my colleague, Dr. Hussein in UK, Dennis in Europe, and myself and Krishna in India, we just started up about a few months ago. And we're going, and we've got a lead investor, Antil, who is working with us for the India market, which alone has about 60 million diabetics. That's a massive market for us. We've been widely covered in the media, socially speaking. We did what we said we did, and we proved our point 2.5 years ago. We have commercialized our product. We've got paying customers. And with COVID-19 being the need, solutions for COVID-19 being the need of the hour, we worked with Singapore's Ministry of Health's IHES Technology Agency to repurpose our scanner to become a Class B medical device for fever detection. It's not an aftermarket thermal product, which some companies offer. It's an actual medical device with over 3,500 clinical trials being done.
Thank you, Ali. I apologize, but we have to move on to Q&A, so feel free.
Thank you.
Any questions from the floor?
Yeah, actually, I have one question. Do you hear me?
Sure, I can hear you. Go ahead.
Yeah, this is Anton from Primary Capital. Do you have plans to go to the US, to Europe, and getting CE mark and FDA approval there?
CE mark already done. FDA is already, we shared a deck with Daria earlier, and that just shows that we have already went to our FDA application. When we went for our FDA application on a device, FDA turned around and said that we classify it for a de novo, which means there's no other product like this in the world. And that's ongoing as we speak right now. This was something that we were planning to finish early in Jan, but with COVID-19, everybody's priorities changed, and hence the iThermal came about. But we have documentation from the FDA saying that we classify for de novo.
Okay, thank you.
All right, it's Alex from RBV. So can you provide me an example when the output of your approach lead to the change of like the clinical treatment? So the question is related to the how you, like your approach are able to actually change something which is made not just to diagnose it.
let me, so early detection is all about how the patient journey changes. You see, if we capture a possible ischemia or infection or undermining or tunneling, we can start the protocol so that we can obviously save the patient's limbs to start off with, and obviously improve the journey and cost burden on the society as well. So as I said, 216 million euros is what Russia is looking at just for chronic wounds. Imagine if there was early detection available right now where medical practitioners had that information, then they can start the treatment protocol for that particular patient, obviously improving his outcomes as well.
Got it. Got it. So do you have already case studies when this happened?
Oh, absolutely. As I said, we are already a commercialized product. All our clinical trials are done. We were in fact featured in the Ministry of Health, United Arab Emirates, when they had the Arab Health Expo and conference in January. They asked us to do a POC in their hospitals. And within a span of about 3 weeks, they were so impressed with our technology that they put us on their pavilion, showcasing our technology and had their own people showcasing what the features of our technology are.
Oh, got it. Thank you.
All right, great. Thanks, Ali.
Sure.
Of course, the rest, feel free to link up with Ali after this. I know many of you still have questions. Feel free to ask him more. Next up, we have Mido.ai. Jivesh, co-founder, please take it away.
Hi, everyone. This is Jivesh. It's good to see everyone. I guess you are able to see my slides?
Yes.
Yes, perfect. So thank you so much for inviting us over. So I'm actually at work at the moment, but it's a good time to talk. So I'm Jivesh. I'm one of the pediatric radiologists based out of National University of Singapore. And I'm also one of the co-founders of Meadow. So maybe I'll start with our executive team. So as you can see, Dornush is our CEO and the co-founder, and she's also the AI expert. My third co-founder is Jacob, who's also a pediatric radiologist based out of Canada. And we have David, who was a vice president tech of commercialization. So we actually started, before Meadow was formed, we started about 2-3 years ago, thinking about democratizing of medical imaging, where people who don't have access to even basic imaging, we wanted to get this imaging to them. So I've traveled the world, I've gone all over the place where I used to go teaching people how to do ultrasounds and CTs and MRs. But I realized that the imaging at this point is very, very centralized. So patients have to come down to the hospital from wherever they are just to get some basic imaging done. So we realized that perhaps ultrasound is a good way to go forward, where it is very cheap, harmless, portable. You can literally put it in your pocket and move around. The problem with ultrasound is that it's very difficult to use. It takes a lot of expertise. I myself am a radiologist. It took me 15 years almost to learn what I do with ultrasound. And I teach medical students and I teach that. So it's not a very easy modality to work with. So CT and MR is very straightforward, whereas ultrasound is very difficult, inconsistent, unreliable in people who are not that trained enough. So this is where Meadow comes in. So we've been using AI, cloud computing, and 3D visualization to simplify the use of ultrasound for frontline users. So you don't actually need to have a radiologist all the time. You can use our technology to train people who are less versed with ultrasound. Maybe within a couple of hours, they can just follow our technology. And even frontline people like nurses, EMD physicians, emergency people, ambulance drivers, they will be able to use this technology and use our expertise to, say, point of care management and diagnosis. So our product, our brain behind our technology is called ARIA, which is Automated Real-Time Intelligent Assistant. So what it does is that in front of you can see there are these 2D images of, on the left is a hip joint of a baby, on the right there's that of an ultrasound of thyroid. It takes up all these images on the cloud system, analyzes on the cloud, and creates 3D models out of it. So and gives out reports on the left of your screen. That is a small hip joint of a baby, and it tells you if it is normal or abnormal. Whereas on the right of the screen is a thyroid. which is telling you that it has multiple nodules inside and scores these nodules accordingly. So, and all this is done online on cloud within, say, in less than a minute. So it's almost like a real-time process. So our first product, this ARIA, is that of a hip dysplasia. This is one of the conditions where babies are born with abnormal hips. And if you don't treat them, if you don't pick this abnormality, babies go on to have very severe disabilities. They end up with morbidities, they end up with osteoarthritis. And these kids actually require major surgeries just to be able to walk. So up to 30% of hip replacement surgeries in less than 60 years of patients are actually because of hip dysplasia. In just Canada alone, $1 billion per year expenses are there just for DDH, which could be prevented by early diagnosis. And of course, I have put references on that. So what we have done is that using our AI technology, we have drastically simplified the use of ultrasound to pick up these abnormalities. A scan which takes about 45 minutes can be done in 3 minutes. And the analysis is so robust. It gives you all the automatic measurements. It gives you a possible diagnosis. It gives you, even if you think, even if you don't do a proper scan, it'll tell you, okay, the scan is not proper, maybe you have to repeat it. And interestingly, we just got FDA approved about a week ago. So this is our first product which got an FDA approval. And this is for diagnosis, not just for assistance. And this is what a quick view of what our solution actually looks like. So it's a viewer which has a 3D capabilities. It sort of tells you if there's an underlying dysplasia. It predicts if this abnormality is normal, abnormal, even generates reports. And this report can be exported anywhere direct to your PACS, to any machine. And this is what is unique for us, is that we are device agnostic, which means you don't have to buy a new machine or anything. Any of your existing hardware, our software will work on it. So all these market players like GE, Siemens, Toshiba, any machine that you think about, our software will actually work on it. We've clinically proven our technology. We've published a very landmark paper on this, where we did a clinical study on close to 2,000 patients, and it got published. And we've shown that our software is actually much better than a radiologist itself in terms of picking up borderline cases. So we're not a hip dysplasia company. We have multiple solutions coming up. So our thyroid nodule detection is almost ready, and we will be going for FDA by end of the year. We are working on frontline conditions like liver tumors, underlying fibrosis, picking up shoulder injuries. And we have about 7 to 8 other conditions lined up. We'll be going for our next raise in about a couple of months' time as well. What sets us apart? Of course, we have done a lot of clinical studies. We have a very robust, strong team of close to 25 to 30 people. Our R&D office is actually in Canada. Our frontline office is here in Singapore. We're close to 20 publications. We have tons of data. We are not reliant on any other hospital. We have our personal data, which is very attuned to a AI solution. And of course, we have a team of radiologists, AI engineers, frontline developers, and marketing people on our side. Just a quick word on our business model. We have direct sales and direct sales to hospitals and radiology groups, but also we are focusing a lot on our partnerships with device manufacturers, PACS providers, and AI marketplaces. As we speak, we're already in discussions with a device manufacturer where we would embed our solution onto their machines directly. So this device manufacturer actually has almost 30% of global market share in ultrasound equipments. And we also have some app store integrations like Microsoft Envoy AI. And we have some very close strategic partners with some radiological groups based out of Canada, which is one of the largest. MIC is one of the largest private radiological group of Canada. And we have very unique partnership with them in terms of data sharing, in terms of pilots, in terms of co-development of further solutions. A quick look at our planned pilots. As you can see, we have a lot of pilots going on, as going from Australia to England to Canada to even Brazil. And a very quick look on our competition. AI space in ultrasound is very limited. There are not many companies who work with the ultrasound and AI. So you must have heard a lot of these people. But what we are looking into multiple solutions. We are more into point of care. We have 3D support, image quality, and hardware independence, whereas quite a lot of our competition doesn't have all that.
All right, thank you.
This is where I end, yes.
Thank you, Dr. Jiresh, and thanks for taking the time today. Any questions from the floor?
Hi, this is Nanoli company. I have several questions. The first one, we saw that the medical device, is it General Electric or this is your own invention?
So we don't have a medical device. This is a software.
Okay, so
this is a software that goes on the cloud.
So does your software works precisely with this small medical device, or it can be connected?
It can be connected to any ultrasound machine. Maybe you have GE, maybe you have Siemens, maybe you have Toshiba, maybe you have Philips. Even from a big machine to a handheld device, it will work on that. In fact, we got the FDA approval for a device agnostic software. We did clinical studies on almost all major ultrasound companies in the world. And we proved that our software actually works on any device.
Okay, and we also saw in presentation that there was some mentioning COVID-19 treatment. Can you reflect any more information about it?
So as we speak right now, we are working on a COVID-19 solution where, as you would know, that a lot of people in China and Italy have been working on a frontline triaging system using lung ultrasound, and we are working on that at the moment. So it should be ready in another month or so, where we will be able, where users will be able to take small videos of lung and send it over to us, and we can give you a grading of possible COVID. So if your lung ultrasound is positive, that patient will require admission to the hospital. If your lung ultrasound is negative or mildly abnormal, these patients can be actually sent home.
Thank you.
It will be ready in about a month's time, yes. We already have the data. We already have, we are in the process of developing it, almost finalizing it at the moment.
Okay, great. If there are no more questions, we would like to move on to Origin Health. Thank you, Jivesh.
Thank you.
Now, Jens, from CEO of Origin Health, please take over.
Hi, everyone. Can you guys hear? Are we good?
Yep.
Okay. Hey, everyone. I'm Jens. I'm the CEO of Origin Health. So we are developing AI technology to assist medical practitioners performing pregnancy scans to reliably screen for birth defects. So more than 8 million babies worldwide are actually born with birth defects every year. So, and birth defect is actually the leading cause of infant deaths. And this actually amounts to an enormous cost to the healthcare system of every country. So currently, ultrasound imaging remains as the only affordable and most widely performed examinations for the screening of multiple birth defects. But this screening is extremely challenging, with over 20 planes to image and more than 100 fetal structures to access. Ultrasound screenings for birth defects is highly subjective and expertise-driven. What this means is that clinicians actually require years of training and experience, and also an extensive knowledge of fetal development to be able to screen reliably. And moreover, with new soft markers being discovered almost every month, clinicians constantly need to update their knowledge to be able to reliably screen for birth defects. The current birth defect screening process is actually really, really time consuming. It takes about 30 to 40 minutes. Yeah. So at Origin Health, we are actually setting out to modernize the ultrasound birth defect screening. As mentioned, obtaining imaging planes requires lots of experience and expertise. And the traditional ultrasound screenings is very, very labor intensive. It takes more than 30 minutes sometimes. So with our automatic standard plane detections and AI-assisted comprehensive screening, we are able to reduce scan time by more than 50%. Our system is based on FMF guidelines, which is an international guidelines being practiced by sonographers doing pregnancy scans. Hence, we are able to enhance the routine birth defect screening capabilities of even the novice sonographers at hospitals and clinics. for them to perform pregnancy scans at international standards. We are also reducing the time for them to get second opinions for high-risk pregnancy cases, which sometimes can take up to a couple of days. And through our platform of registered fetal medicine specialists around the world, we are able to provide access to specialist opinion with just a single click away. So what is unique about Origin Health? First of all, we are a drag and drop tool, cloud-based applications, meaning that we work on all PC and mobile platforms. No installation required. We also provide a complete fetal anatomical evaluations, which is compatible with any existing PACS system out there. What this means is that it allows for a seamless integration to any existing workflow at hospitals, clinics, and diagnostic centers. We are able to red flag high-risk pregnancy cases and provide a rapid triaging and referral at the point of examination itself, thereby allowing hospitals to offer enhanced quality care for their patients. So what do we have for tractions? Throughout this, we are able to get 6 data sharing partners in Singapore and in India, giving us exclusive access to more than 500,000 images and pregnancy outcome data. So we have also submitted our RCS in Singapore and India, and we'll be starting pilot trials at 30 centers across the entire of India. So for the founding team, I'm Jens, the CEO of Origin Health. I have more than 10 years of experience in investment banking and commercializing technology. My co-founder and CTO, Dr. Sripat, has a PhD in developing clinical-grade AI for medical imaging. Our technology is based upon the deep learning techniques, which he has invented during his PhD. Our clinical director, Dr. Gauri Shankar, has more than 20 years of experience in fetal medicine and radiology from Imperial College and King's College London. Our advisory team, we are advised by key leading figures in the field of fetal medicine globally. And also for our clinical team, our development is clinically led by fetal medicine specialists from Singapore and India. Yep, and that's all I have for you guys today.
All right, thank you, Jens. Any questions from the floor?
Yeah, it's again Alex from RBB speaking. So I would start from afar. So at what time, like in weeks, can you start detecting the abnormalities?
Sorry, can you repeat the question again? Yeah.
Sure. So,
yep,
at what time in the pregnancy you can start detecting abnormalities? You probably you cannot do it from day one. So what time is when you can start detecting them?
Okay, that's a great question. So currently we are studying at a mid-trimester scan. So meaning that's 18 to 24 weeks. So research have shown that actually more than 50% of fetal anomalies can already be detected during the first trimester, which happens within 11 to 14 weeks. Okay. So currently we are focusing on mid-trimester, so that eventually we can do a longitudinal studies to be able to go back to the first trimester and be able to screen for birth defects at the first trimester earlier. Yeah.
Yeah. Okay. So then the question is, well, typically the law says that after 12 weeks you cannot do abortion, and right. There is a limited number of therapies that you actually can do to affect the embryo. So okay. Then how this detection how this detection will actually affect outcome at the end of the day?
Okay. Well, this is a great question. So I can give you a more specific example, which is what happened in India. So in India, the legal so-called gestation age to abort a baby is 20 weeks. And what happens is that a lot of mothers actually do not even go for their first pregnancy scans, maybe after 20 weeks. So what this means is that they have already passed the legal so-called date for termination of babies. And this is actually a huge issue. How we're trying to solve this thing again is, of course, other than enabling sonographers to be able to perform pregnancy scans earlier, the other thing we're actually doing is, as you mentioned as well, about what we can do when we actually screen for birth defects, is that there's actually a lot of prevention measures. First of all, I'll just give an example. So if we are able to detect, let's say the mother is having some kind of vitamin deficiency, then we are able to kind of provide a multivitamin supplements for the mother. And this can actually reduce causes for birth defects, maybe up to 70% of the time. Yeah. The other kind of intervention will be more like surgeries and so on and so forth. That's actually more of a later stage. Yeah.
Got it. Got it.
Yeah. Do we have time for one more question?
Yes, just one more.
Yeah, thank you. Sorry if I missed it, but have you conducted the competitive analysis, and what about the competitors space?
Sure. First of all, we are device agnostic. What this means that, okay, a lot of people will be asking, okay, would the OEMs, let's say the GE, Philips, so on, or Samsung do similar stuff like this? So our answer to that is there are already more than, let's say for India again, there are already more than 100,000 equipments, ultrasound equipments that are already being deployed in India. And there's no way that, you know, the GE or the Philips be able to kind of retrofit new technology into these machines. So this is where our key competitive advantage come in, being device agnostic, meaning that any devices that are being deployed already in the market, we are able to use it. They are able to use our technology to be able to do a more comprehensive screening of birth defects. And just one thing to note as well, which is the new series of, let's say, GE machines are really, really expensive, which is actually unaffordable to a lot of, let's say, clinics and diagnostic imaging centers. So this is pretty much our competitive advantage in the market.
Okay.
Okay, great. Thanks, Jen.
Thank you.
All right, now we'll have Creative, Anish, CEO and co-founder. Feel free to take it away.
Hello, can you guys hear me all right?
Yes.
Yeah, awesome. And can you also see my screen? Because sometimes Zoom just misbehaves.
Yep, okay.
Okay, awesome, lovely. So hi, I am Anish. I'm the CEO and co-founder of Curative. And it's a mission to make cancer diagnosis fast, accurate, and affordable. So just a bit of background before we jump into the technology. So as of now, the world is facing a critical shortage of pathologists. I mean, overall, we need 5 times as many pathologists as we have, and even in developed countries like the US, the ratio can be as low as 4 pathologists for every 100,000 people, and in Asia, this is well below 1.5 per 100,000. And so cancer diagnosis used to not be as complicated as it is now. But now that we have advanced treatments which have come into play, the need for accuracy in their analysis has gone up by a large amount. And this means that the amount of work which has to be done on every slide has gone up by multiple times. And this means that the pathologists have been left overworked, and this has led to increase in both burnout and in the amount of errors which are being encountered. So this was already a big problem before COVID came into play. And at that point of time, digital pathology was being looked at as a potential solution to this problem, because it would make analysis much easier. But now that COVID has come into place, things have gotten much worse, and the need for automation has been even more sharply described. So let me just show you a quick example of how difficult this work is. So what you're seeing on your screen right now is a case of prostate cancer, where the doctor is expected to count the brown and blue cells in a slide. Now this seems simple enough until you realize how large these slides actually are, where each slide has millions of cells, and you're expected to count all of them one by one. And then of course, this is not something which doctors end up doing. They end up making an estimate, which is not great for the patient. Now our systems can do the same analysis in seconds and with a much higher quality than a human can. And so this was just one example, but our systems handle the tedious and complex analysis across multiple cancer types. I mean, which have helped doctors identify things like micrometastasis, which is spotting just a few 50 to 100 cells which are abnormal out of a slide which has like millions of cells. Things like land quantification or and then even the next gen analysis is now in place. So AI is great, but you always need a system to deliver the AI. And so as of now, like digital pathology is just being adopted. And so for reference, like really what like digital pathology is it's basically a healthcare, sorry, basically a microscope which can take high resolution images. And so it is not enough to just have AI which sits on top of this, but you need a system which can help pathologists do all of their jobs. And as a part of this, you can't expect them to actually stitch together multiple different technologies. So to address this, what we are doing is we have built Pantheon, which is an AI-powered pathology workbench where pathologists can do all of their work in a single interface. Now, this has already been like registered as a Class A medical device with the HSA, which is the Singapore version of the FDA. And what it basically does is it brings into digital world everything around pathology, like right from administration to having like a specialized tools for digital like viewing, analysis, and telepathology. And of course, it serves as the window to like deliver our explainable AI like solutions. And so our systems are explainable because we don't just give like a black box answer, but we can actually say we are saying this because we have spotted like such and such abnormalities in the tissues. Now, to build this, it is very important to actually get an understanding from the clinician's point of view. So from the very beginning, we have been working with Singapore's largest hospitals, NUH and SGH, with whom we have research collaboration agreements. This gives us access to images, but much more importantly, it has given us access to expert annotation. And that is what has helped us build solutions which are extremely high performance. And these are currently undergoing clinical validations and will be soon going for HSA and CE markings as well. So we are currently working with some of the largest healthcare institutions across Singapore as well as India. And to build this whole thing, you of course need a strong team. So I have finished my PhD in mechanobiology, which is a mixture of physics and bio, where I used to do like a lot of microscopy and then the analysis myself. My skills are complemented by my co-founder, Kavi, who has finished his PhD in machine learning. And recently we have also had Dr. Rajasa join us as a medical director, and she is actually a pathologist who has worked a lot on the marketing side as well. And so with her on board, we have completed our set, and the rest of our team consists of actual pathologists, experts, who computer vision, regulations, and software development. And this team is supported by some of the top pathologists in the world. I mean, they are the heads of their department here in Singapore, but they are also sitting on things like the WHO board, and they're teaching the world as to how to do pathology analysis. So that's about curative, and I'll be happy to take questions now.
All right, thanks, Dr. Inish.
Mm-hmm.
Questions from the floor? Dara?
Does anyone have questions? I think we had some from RBV. Alexander?
Yeah, so can you please tell me what are the main detailed pathological focus, and what are the accuracies on the images?
Sure. So essentially, we are actually looking at a wide variety of cancers. These includes like prostate cancer, colon cancer, breast cancer, and we're also looking at things like very difficult cancers such as lymphoma, and we are also starting to work on things like infectious diseases, which have also like a similar kind of analysis. In terms of performance, what we do is we do two levels of analysis. One is in-house, where we ensure that the performance is above 95% sensitivity and specificity. This is at the slide level, which means at the case level it is even higher. And then we go for clinical validations. So we have finished one of our validations in November, which was for prostate cancer. That had about 96%, both sensitivity and specificity. So I mean, that's the quick answer, but there's a lot more details there, which will be.
Yeah, perfect. Thank you.
Thanks a lot.
Okay, great. I think that's all for our first group for AI-based diagnostics. So thanks everyone who had presented. Now, because of time, we might directly jump straight into our second group, which is personalized health. Now, the next company in line is BioRim. So Amrish, CEO of BioRim, please feel free to take over.
Yep. Hi, everyone. And let me just increase my screen. Thank you for attending today. And I think Origin Health gave a very nice introduction into fetal care and pregnancy care. And what BioRhythm is actually hoping to look at is that first 9 months of life, and understand how through our expertise in mobile technologies and remote monitoring, we are able to actually enhance care and transform care from the wave. And like what Origin Health mentioned, fetal abnormalities can cause problems, both maternal risk and fetal risk. And fetal risk and maternal risk can cause the fetus to lack oxygen. And for this, the general mode of monitoring is something called a CTG, where fetal heart rate is used as a proxy for fetal oxygenation and well-being. But as you can see, in about 40 years, the mode of care hasn't changed. And this means the pregnancy experience for the doctor, the mother, and also possibly even the clinical outcomes won't have changed significantly. And what you're looking at is a highly inefficient system that doesn't address many of the questions we're looking at today, including in the time of COVID, why are we bringing otherwise well patients back into the hospital for monitoring with increased infection risk? Why are we continuing with an inefficient system where patients could potentially perform this monitoring at home, get the results, and consult the doctor and make your consultation more meaningful? And even just attend for some of these pivotal scans like what Origin Health was mentioning. And looking at this whole thing, it's quite dramatic in the way that care could be changed. And you need to, from the clinician's perspective, they're really looking at how can I actually do this whilst maintaining patient safety? And COVID has provided a perfect trigger where they're forced to do this and they're not going back. When they can monitor at home, they will monitor at home. And for patients, it's, not how can my care change to make my pregnancy better? It's not a disease, but rather how do I get through this as anxiety-free and as happy as possible? And with regards to that, we've developed the FEMAM health monitoring system for mother and child. It's a comprehensive system with devices, mobile applications, and clinician web platform. So it's an end-to-end monitoring solution for hospitals. With regards to the devices, we've built a fetal and maternal monitor, which is able to monitor maternal fetal heart rate and uterine activity, which is exactly what they monitor in hospital. And we're able to do this with equivalent standards to the hospital monitors. Also, we're able to connect accessory devices for blood pressure, glucose, and weight, which are often accompanying measurements that are required by doctors. And lastly, doctors can also ask questions on the mobile phone according to the type of condition the mother has or the type of symptoms that the doctor wants reported. The mobile app is able to accommodate all these things in a virtual visit. So the doctor can ask for these data Monday, Wednesday, and Friday. And exactly like how a mother would go to hospital, the mother would log on onto her mobile app complete the questions, take the measurements, transmit it, and between the hours after the monitoring session, a doctor or a midwife can review the results and call the mother back if necessary. And this addresses the problem of not bringing back women who don't need to be brought back, making the system more efficient, and having better data collection. For the clinicians, we can triage the patients red, yellow, green, where red is a crossing of a significant threshold where the patient's in danger. Yellow is where the patient needs to be observed, and green is where the patient is normal. And these thresholds can be set by the doctor for any one of the measurements or questions, depending on the type of risk. Our technology is fundamentally, how do we take signals, strip out all the noise, look at the key features? And this is essential for the home, because mothers put the devices on themselves. There's multiple devices we cannot, sources of noise we cannot control, and hence this is what we're good at. We worked with Skolkovo in the past to be able to do this for adult ECG, and now we're applying this to fetal ECG. And collecting data from the home when the mother's moving around, potentially doing other things, is a non-trivial problem. And that's exactly what we did. My wife voluntarily, I have to use this in inverted commas, my wife voluntarily signed up for an experiment where we actually did this on our daughter before she was born. And you can see the quality of signal that we're able to obtain at home. And so for the clinicians, we provide better analytics so that they can make better interventions on time. For the hospitals, is how do we deliver care in a more efficient way and potentially new revenue streams for private hospitals and increase patient satisfaction. We're launching in 2 stages, where we have the light version without the fetal monitor, so we can offer a telemonitoring solution in times like COVID. And whilst we get regulatory approval for the fetal monitor, which is expected in Q1 2021. Our business model can vary to adapt to private and public systems. In the public systems, we've modeled it on the UK and Australia, where there's a fixed bill per pregnancy. And our per patient per month model actually allows them to save money. For the private care, this offers additional revenue streams or per session, which allows reimbursement in the US, for example. And so for Russia, this can be adapted depending on the type of healthcare. We work with renowned hospitals, Australia, UK, Singapore. We work with the top guys who have written the guidelines of fetal monitoring. And this is where we see the transformation from the key opinion leaders down to the rest of the world. So the team is actually built upon our academic team from a cardiologist, head of biomedical imaging at EPFL, and myself, who was the graduate student or the slave, depending on which angle you look at it. So the team has really been sensational. The software, data science, product, business development, market access, and having doctors in-house full-time actually really helps. And what we're looking at with Russia here is exactly the way we've entered the market in every other market. We're looking for clinical partners who can be key opinion leaders. And this is critical because getting the institutions where they can actually spread the word is key, or institutions which can expand to their network is key. And so what we're looking for is clinical pilots and potentially commercialization. And also accompanying this as part of the ecosystem, we're looking at people who can help us with the health authority registration, sales distribution, as well as localization of the product. We understand that fetal monitoring may have different protocols in different countries, and our system is flexible enough to adapt. And hence, how do we localize the product to the local health guidelines as well as a culture of the country? And with that, yeah, I would like to thank everyone, and thank you for attending the presentation. I welcome any questions at this point.
Right, great. Thanks, Amrish. So questions from the floor, please.
Anyone has questions? Yes, please.
Hi, I'm Sophia from Medsi Group. I was wondering if you provide telemedical consultations for your test subjects, I suggest right now, and if not, are you open to partnering with a medical organization so that they, so in my case, Medsi would provide telemedical consultations instead of you?
Yes, so we do not provide the medical consultations, just to be clear. We provide video and messaging capabilities for the care providers to actually interact with the patient themselves. So continuity of care is critical in a pregnancy. And for Medsi, I mean, for all your patients, we allow you to assign the specialist to your patients. And if this is possible to be a remote service where Medsi can provide the service for other institutions as well, we're open to that, and we welcome that conversation.
Oh, thank you.
Yeah.
Okay, great. Any more questions? If not, thanks, Amrish. Next up, we have Kinexus, Abhishek, co-founder and CEO. Please feel free to take over.
Hi, good morning to everyone in Russia, and good evening, almost good evening to everyone in Singapore. I'm Abhishek. I'm the co-founder of Kinexus. Kinexus is a medical device and data analytics company. Our mission is to enable personalized recovery and optimal care for patients using wearables, data analytics, and AI. And our vision is to develop the world's first fully connected continuum of care globally. Now, a bit about my company. We are a Singapore-based startup which was founded in 2015. We are a bunch of 9 engineers, developers, salespeople. Till date, we've raised close to 2 million Singapore dollars in funding. And we are looking at FDA clearance and CE mark this year, up to 250K of projected revenue. We've already started making our revenues. In fact, our first 6 months of revenues, we are at a point. And we look forward to launching multiple products in the later half of this year. Now, Kinexus is basically building products across 2 different segments. One is what we call as the medical segment, which is our product for rehab, ortho, neuro, and sports patients who are either who have either gone through a surgery or have been injured and are undergoing recovery and rehabilitation. We provide a wearable device and a digital therapist, which is AI powered for them. And on the other hand, we have sports and fitness patients, adults, healthy adults like everybody of us in this call. And we provide them test kits and personalized recommendations directly related to their health for performance improvement and fitness management. So that's us. We eventually are looking at building a holistic health data platform which uncovers valuable insights. So all of the wearables, all of the test kits, and all of the trackers that we use and smart devices that we use, consolidating all of that data in one single platform and using that platform for clinical decision support, for patient guidance, for personalized health and recommendations, and at the end of the day, enabling better health and better care for everyone. Now, as I said previously, we have currently achieved a monthly recurring revenue of about 10,000 Singapore dollars per month, and we are growing at a healthy rate of 50% per quarter, even during the COVID lockdown period, which was April and May in Singapore. And we are looking at basically tripling our revenue in the next 3 quarters. And the main driving force behind our revenue is currently wearables and then other segment products. Now we talk about the market, the rehab market first, because almost all of our focus is currently in increasing our market share for rehab product. Basically, globally, we have $34 billion that are spent on rehabilitation and recovery after orthopedic surgeries. 300 million people around the world suffer from osteoarthritis. 1 in 2 Americans who actually has a musculoskeletal problem, who would be in, and that's more than the total number of cardiovascular and respiratory diseases combined. Now, the problem is after surgery or an injury, there is an extended period of rehab and recovery where patients should comply to the actual prescription. There must be progress monitoring, outpatient visits, which ideally leads to full recovery. What actually happens is, for surgical patients, up to 20% of them suffer from complications such as joint stiffness, pain, infection, get dependent on walking frame, which leads to permanent pain and functional loss, and takes up to 2 times the recovery period, readmissions, and complications such as recall surgeries. Quickly moving on to our first product, which is a mobile application for rehab patients. That's a software-only product solution for patients who are undergoing rehab. Now, this you can download on the App Store. You can also download on Google Play at the moment. Essentially, it has a learning hub and educational content for patients, a community, personalized rehab prescriptions and programs that can be assigned to you by your clinician. For you could do teleconsultations, and also there's a marketplace where you can buy all kinds of rehab products to help you in your recovery journey. For clinicians, they can do remote prescriptions, engage their patients better than just a mom and pop shop kind of setup. It's an additional sales channel for them. They can convert patients whom they teleconsult, and of course generate additional revenue for themselves. Now, how do we make money from this? Is users access general content for free, and then revenue comes from sales of personalized exercise programs, teleconsultations, and rehab products. Now, I'll quickly move on to our second product, a variant of our rehab product, which is basically a medical device. It's a wearable device called Kimia, and it's built upon a US technology, which is currently has a close to 20 company which we have licensed from, a worldwide license, currently close to 20 patents across the world. We are currently trialing this product in 6 different projects across 4 different public hospitals in Singapore, doing up to 800 patients in the next 12 months. We estimate that these projects will ultimately lead to contracts with these hospitals. And besides the projects with the hospital, we have engaged the leader in implant industry, which is Johnson & Johnson. We've actually signed agreements with them on data sharing, and we're currently working on a big data project on a patient risk stratification tool. So DepuSynthis is the world's leading orthopedic implant supplier, and we are currently working with them on developing a patient risk stratification tool, taking care of the entire journey of the patient throughout the continuum of care, from pre-operative stage all the way up until post-operative and complete recovery. We are currently a team of 9 individuals with skill sets across product, fundraising, sales and marketing, business development, quality and regulatory, and software development. We've currently looking at basically getting ISO certified within this quarter, followed by FDA, HSA, and of course TGA. The second market being Australia. We want to hit 1,000 unit production capacity per quarter by June 2021, and file for the patents and trademarks. We currently have filed multiple patents within Singapore, as well as trademarks that we've already achieved. Penetrate about 100 rehab centers, and generate 150K monthly recurring revenue, serving more than 4,000 patients annually. That was me, Abhishek from Kinexus, and I now welcome your questions.
Right, thank you, Abhishek. Questions from the floor, please.
Yeah, can I ask a question?
Sure.
Sorry, Victor, you wanted to ask something?
Yeah. Good morning, everybody.
Yeah, okay, go first.
Okay, Victor.
Victor, first off.
Yes, please, Victor.
Thank you. Thank you so much for Rehab Center, and I'm the chief of orthopedics center as well in Moscow. So the process, in particular, their urgent situation and their urgent problem with the increasing of orthopedic operation and growth of rehab logically patients, and this process usually takes from the several months to several years, especially in the top level athletes, and we have these several problems all over the world, such as the very low percentage of the high level physiotherapists, and we have in Moscow, like you have, I think, very terrible traffic and the very difficult accessible for patients to rehab clinic, and And the third, the last is, but not least, is the competition on the rehab market. And the question for the speaker, please, could you kindly share with us about your opinion, about your vision for how do you solve the problem associated with the low aspect in your country, because in Russia it's quite difficult because it's not a lot of law acts, and that's why my question is about that. So, and the second question is, are you going to upgrade in the future your device, maybe with combining with the another sensors like EMG sensors, or maybe combining with the three-dimensional movement analysis or something like that? Thank you. Two simple question. Thank you very much.
Yeah, Dr. Victor, thank you for your question. I looked at the details shared, corporate profile shared. I was very interested to talk to you, and very interested in also knowing about your work at the Federal Research of Clinical Center for Specialized Medical Care and Medical Technologies. So I'm happy that you asked the question. And now coming to your questions, first of all, the low people not getting adequate therapy is precisely why we launched or not having access to the expert physiotherapist, expert high-level physiotherapist is precisely why we launched the software-only product as the first thing in the market, because we want to enable access with this product. And how we can enable access is typically, if you look at most of the musculoskeletal patient profiles, most of them, they require a short amount of time, but with an skilled therapist or a skilled clinician to consult about their problem and probably get an exercise program or therapy that is personalized to them, right? We enable, and people are generally reluctant, or they're non-compliant towards actually going to an outpatient center and getting. We kind of bridge this gap. How do we bring the therapist to the people instead of people having to go to the therapist? Is through our product, through the mobile application. So what we do actually is, and what we are building right now is basically anybody around the world. Let's say we have, the world's best physiotherapy center in Moscow, for example, right? And there are people around Russia who benefit from accessing the physiotherapist at that center. But they of course cannot travel to Moscow just for having a condition related related to a musculoskeletal problem. How can you still teleconsult with that physio? So we provide a full-on system inside within the app, wherein you can actually book as less as a 15-minute teleconsultation spot with the physiotherapist or with the orthopedic clinician. Get consulted, get a first-hand consultation on the problem that you are facing as a patient, get personalized therapy recommendations and exercise programs, and do it at home, right? So you've got the first level of assessment right from the comfort of your home, with an expert who's probably thousands of miles away, right? And are at the part of the world where we have Singapore, which is a center of excellence. We've got world-class physiotherapists here. We've got world-class rehab centers here. But if you look at countries around Singapore, we've got Indonesia, we've got Thailand, we've got Myanmar, we've got Malaysia, we've got Philippines. All of these places where the number of trained and the number of experts, clinicians are not as high as it should be to serve the needs of the population. And that's exactly where we come in. We launched this in Jakarta, in Indonesia, can actually teleconsult experts in Singapore. So that's how we are approaching the problem number one that you'd mentioned. Second is, are we looking to combine the device with EMG sensors, are in fact building a system of home-based tracking devices that can do right from continuous monitoring to functional assessment to even evaluating things like pain scores, and of course, emulate the gate lab system, which is basically $1 million setup, right? With a comparatively low cost system, like at
In
least,
Munich?
so patients. Yeah, I'm sorry, you said something.
In Munich, if I got you correctly, in Munich, you have the laboratory of movement analysis. No, I can hear you well. Which one is the city?
Yeah, correct. There is in Singapore itself, we have a movement analysis lab in Singapore General Hospital. That's it's a multi-million-dollar setup, which we have been validating our system against. All the accuracy and all the data that we collect from our system, how accurate is it compared to the gold standard? I'd be happy to share more data later with you offline or email, after the call as follow-up.
Thank you very much. Great. I will be
Thanks, gentlemen. I know Anton still has a question. Feel free to reach to Abhishek. Reach out
Okay,
to
I'll try to be real quick. What metrics do you use to measure the performance of the mobile app you mentioned?
Correct. So the mobile application itself, as of this time, there are 4 different categories of data sets that we are looking at, right? One category is session monitoring. Session monitoring is like range of motion. We do things like compliance. We do things like hold times, and we capture all of that data when patients are actually performing their rehab routines at home. So that's one class of data. Second thing which clinicians are particularly interested in, and the data that is not readily available to them using current systems in the market or current sensors in the market, is what we call as continuous monitoring data. Now, this is directly related to activities of daily living. Now, especially in case of elderly patients, totally replacement patients, especially in the case of neuro patients such as stroke patients, this is extremely important because if let's say the patient is able to get the but his functional activities are still limited, then you've not really solved the problem of the patient, which is basically complete functional recovery. So
Okay,
that's the second class of data that we're talking.
Yeah, sorry, my question was not basically as to functionality of the application, but to how many users use it monthly or something like that. Can you comment on that?
Sorry, gents. I might have to stop you right there because of time, but feel free to...
No worries. Yeah, okay.
Yeah, apologies. So next up, we have Osteopore. Osteopore is a listed company on ASX. Dr. Lim, CTO of Osteopore, please take over.
Okay, yeah, thank you very much for the introduction. So today I would like to share with everyone a little bit about regenerative implants with 3D printed biomimetic microarchitecture. So I would like to start off first with saying a little bit about the concept of tissue engineering and regenerative medicine. So for those of us who are familiar, this is largely a research concept where we combine biomaterial scaffolds, growth factors, and cells to engineer tissue in the lab. But since its inception in the early 1990s, there has been not a lot of successful clinical use scenarios that have been demonstrated. With the Osteopore 3D printed scaffold, we have managed to achieve what we call a regenerative implant, and that is through the interaction between the scaffold, the patient's cells, and bone marrow derived growth factors in order to elicit tissue regeneration in the body. The company's mission is to empower the body to regenerate tissues that were damaged through trauma, disease, or surgical procedures, so as to minimize or eliminate late complications that are commonly associated with long-term implants. We utilize 3D printing as the manufacturing technology for our implants. And if you look across the various applications of 3D printing in the world right now, we are right at the beginning of regenerative technology, and we have been so since 15 years ago. We use a 3D printer to develop regular and consistent biomimetic microstructures that are similar to cancellous bone. This allows the infiltration of stem cells and blood vessels to eventually lead to tissue regeneration. And this is the concept of regenerative implants. We aim to resolve certain unmet clinical needs that are associated with either permanent implants, autologous bone grafting, or with synthetic bone graft substitutes. When we compare ourselves against permanent implants, the bioresorbability of our implant allows better integration with surrounding tissue, and due to its non-permanent nature, it avoids some of the late complications such as late extrusions or late infections. When we compare ourselves against autologous bone grafts, there is no need for donor site morbidity, and therefore this is a great plus for the patient. In terms of bone graft substitutes, which are typically provided in particulate format, the structural nature of our scaffold allows for weight sharing with the surrounding bone, and this is a critical part of bone regeneration. The choice of our biomaterial is such that it degrades in tandem with tissue regeneration. And in the top panel over here, you can see in a series of CT scans from 1 month, 4 months to 12 months post-operative, that the bone in the burr hole of the cranial is regenerated eventually. In the bottom panel here, this is a customized implant that was used on a 9-year-old patient, and 2 years later, we do see complete bone regeneration as indicated here on the CT scan. Our platform technology allows not only customized products, but also standard products to be manufactured in the same way with the unique microarchitecture. So for customized products, what we typically do is we take a CT scan, we digitize it. We do go through a process of scaffold design before it's fabricated and supplied sterile. To date, we have successfully implanted more than 30,000 devices globally, and we have more than 10 years of clinical follow-up. Some of the products that we have commercially launched are listed in the left panel over here, and they have been applied across various craniomaxillofacial surgical specialties such as neurosurgery, plastic surgery, oculoplastic, and general craniofacial surgery applications. We would like to highlight some of the potential advantages for healthcare stakeholders that Osteopore is interested in. For one, we would like to minimize or eliminate future payments for resurgery and associated long-term care, thereby reducing overall treatment expenses for the payers. So these are the government, insurance, and the patients. In terms of hospital resource utilization, we would like to allow the focused consumption of hospital resource for new patients instead of readmissions and revision surgery, and for surgeons to provide a sustainable clinical outcome for patients and their families. We continue to lead the world in regenerative technology through collaborative development, and you can see clearly here that we do have an international collaboration network. Our products have been approved in various regulatory agencies such as the US and Europe, and across various countries in the Asia Pacific region. We see ourselves as different from the competition because we adopt a biomimetic structure and combined with a bioresorbable biomaterial. We have been featured in various awards and analyst quotes, including ones from Quintiles IMS. And we have been featured in various news articles by providing quality patient care to patients in need, as well as saving the limbs of this particular Australian patient back in the year of 2019. In September last year, we were listed on the Australian Stock Exchange. And we would really like to use our technology to allow patients to live confidently. Thank you.
All right, thank you, Dr. Lim. Questions from the floor, please.
Victor Mukhanov, again.
Sure, Victor.
Thank you very much. It's very interesting, but very interesting subject, very interesting presentation. And my question is, it's beyond my understanding, by the way, but I'm not the laboratorist. I'm the practitioner surgeon. I'm the chief of rehab center. But it's very interesting. If I got you correctly, you can make the 3D model of the bone. And two questions, as usual. Do you have the experience with the working with the orthopedic surgeon with the restoration of the bones of lower extremity? And the second question is how to do it, because it's not enough only print the bone. You have to make the load, mechanical loads in the laboratory, just for making the right architecture of this model, isn't it?
Yes, thank you, Victor, for the question. Yep, so to answer the first question, for the lower extremities, yes, we have done a couple of cases, notably in Australia, Germany, and Oman. And this particular patient, if you see on the top left panel here, Ruben, he had a case of bone loss in the tibia. So that was about 36 centimeters of bone that was removed from his tibia. Yeah, so we customized an implant for this patient, and along with the surgical technique of putting in an intramedullary nail, we managed to grow back the 36 centimeters of bone for this patient. And 2 years after surgery, he is able to walk unaided. He doesn't have to use a crutch to move around. And he is pretty much looking forward to getting his commercial pilot license. So yes, we have experiences in reconstructing lower limbs and even upper limbs. Right? So we have done some cases in Singapore for the hand. And you are right about the microarchitecture. And that is why we chose to use a 3D printed technology, because then we can create something that mimics the cancellous bone in terms of its very open, porous structure to allow vessels and bone tissue ingrowth.
Super, great, thank you, perfect. Thank you very much.
Okay, great. Any more questions? If not, next up, last but not least, Imagine Labs.
Hello, this is Xiaoyi from Imagine Labs. Can everybody hear me?
Yes, we can hear you.
Okay. So, well, thank you for having us at this event. I am the Senior VP at Imagine Labs. A little change of tack. We are in the genetic space, which is DNA. We have been established since 2016. And the reason is personalization is a trend that is growing in health and wellness. And a lot of skincare, nutrition, and even medical brands are now trying to get into the personalization. And recently, we were mentioned in a McKinsey Quarterly, our work in personalized skin, but actually, as I will show you in the following slides, we cover the whole gamut of health and wellness. So we are the platform that enables businesses to create customized products and services based on your consumers and patients' DNA insights. And we cover the end-to-end service from the DNA testing itself to the reports to customized wellness products. Currently, we have a skincare serum and personalized nutritional products. And we are now working with some of the largest health services, nutrition, beauty, and fitness brands in Asia Pacific and the United States. Our company is headquartered in Singapore. I personally is based in London right now, so my time zone is quite similar to Russia. So in terms of the range of DNA tests, currently we have the largest range in the market, covering fitness, skincare, prime is longevity, nutrition deficiencies, children's health and talent, as well as allergy. And according to the reports of the users, we have the capability to create personalized nutrition and skin serum blends that is really individualized to n equals 1. And our reports, we have been selling to fitness gyms, beauty spas, medical groups, and the feedback from the market is that our reports are very easy to understand and actionable. And this is one of the samples of the longevity report that you are seeing.
I'm sorry to interrupt you. I think we can see your slides right now.
Oh. Let me check. Can you see it now?
Yeah, it's starting. Yeah, now we can see. Thank you.
So when was the last one that you saw?
We haven't seen first 2 slides, but I think you can start from the third, just not to lose time.
Did you see this?
Yeah, can see.
Okay. So as I mentioned, these are the range of DNA tests and personalized products that we are offering. This is one of the samples of our report. The feedback from the market is that it's very easy to understand and it's actionable, meaning that it actually tells you what kind of diet, lifestyle, and exercise recommendations and lifestyle changes that you can make. So this is very useful for the doctors to have a general idea and then insert their professional opinions in following up with the patient. This is the precision supplements blends that we are creating based on individual DNA report. Again, this is quite popular among the doctors and medical groups that we are working with, because apart from follow-on tests that they can prescribe, this is something that is incremental for the doctors to be able to prescribe the vitamins based on the genetic nutrition deficiencies. And we also have the capability of formulating precision skincare. This is very exciting. There are about 1,000 possible combinations that is based on our genetic report as well as environment factors. Because of the COVID-19 and the demand in immunity supplements, we have also come out with a new range of immune fortified supplements with optimal dosage of active ingredients that have been shown to boost immunity, right? So the whole customer journey from the sampling, this is saliva sample, to the lab processing and getting the results is about 2 weeks. And 1 more week, you get the wellness products. So we are working with some of the largest names in health and wellness. I just want to show you one of the key collaboration we have in the US, which is Avira Health System. They have 1 million patient base. We have just worked together to come up with GeneFolio, which is a private label solution with them. They are selling their tests in their 4 medical specialties. So this is also another medical group. I'll just skip. So what makes us different? Our ancestry-based genetic risk analysis takes into consideration of the user's genetic background in order to give a more accurate result. And we have already received a US patent for that. And we are very different from other DNA test companies in that we are B2B focused, and we provide private labeling DNA tests for brands, and we have the widest test portfolio and language localization. So these are all the tests that we have, 7 types of tests, as well as localization in different languages, English, Chinese, Japanese, Thai, Indonesian. We can also support our partners in translation into Russian, for example. So I think the time is up, and I'm happy to take questions. This is the team, both the founder and I. We have both genetic and medical background, as well as investment and operations in healthcare companies. And Dr. David Kunzing and Ken Fong, these 2 are the lab and product innovations. And these are our scientific advisory board. All right.
All right. Thank you, Jai. Questions from the floor, please.
Yeah, it's Alex from RBV again. So if I could ask a question, so what would be like the accuracy of your test? Was it validated? Because, well, it's well known then when we take genetics and try to assess something, like it works relatively well with like oncology prediction. But if we speak about fitness, like wellness, like the correlation between genetics and actual, like it's, I wouldn't say there is no correlation, but it's like very low correlation.
Yeah, so thank you for the question. The accuracy is a function of the amount of scientific studies that has been published over the years. I think in the oncology space, studies have been started since a few decades ago. So the more studies there are, the more validated the genes will be. So in the wellness space, yes, I agree. Some of the areas in wellness are less advanced than others, but things like obesity, it's pretty well established. So if you look at this process, the SNP detection is where the magic is, right? So there are so many genetic companies in the world that offers different flavors. So for example, each company will provide different traits. So they will provide different reports, some on health and wellness, some on oncology, some on ancestry, and so on. And each of them will also look at different genes. So the way that we have built a database of genes, we follow a stringent selection criteria in order to decide whether a study will be included in the calculations. So as more and more studies are published, the accuracy will be higher. That's number one. The other aspect is the ethnicity portion that I was talking about. So there are more and more evidence that has been published that the genetic insight from one ethnic group cannot be translated to the other. So for example, schizophrenia, there's a study that was done between Caucasian and Asian genes. The gene sets are pretty different. So we do take consideration of that to increase the accuracy of our reports.
Got it.
Yeah.
Thank you. Any more questions?
Yeah, the another question is how many clients do you process a month or a year, and does your product cost much?
Yeah, so thank you for the question. So we have different business model. So one of the business model is we actually do the testing for our partners and provide the results. And as you see, we have customers and partners from different parts of the world. In those cases, for example, Avira, they have the lab themselves. So they can run the genotyping as long as their system is compatible with our bioinformatics, and we are able to provide them with the reports. So we are pretty flexible. And so far we have generated like 5 figures of report. I can't really divulge that much. But it's a very well-established process with proper data privacy and security, so much so that even a healthcare system in the US have selected us after a very rigorous due diligence process. And we are also working with certain global brands. The announced ones are Neutrogena under Johnson & Johnson. We are also working with the Asia side of GNC. It's not the one in the US. It's the Asian franchise of GNC is the most successful one in the world because Asians are still favoring that brand. So we are very used to working with international partners from various parts of the world. And I personally now is based in London because we are having some conversations and partnership discussion with European partners.
Yeah, okay, thank you.
Yeah.
All right. Any more questions to Imagine Labs? If not, I think we can finish the session. We'd like to thank everyone who joined us today from Russia, from Singapore, from UK. And as a next step, we are going to share the survey form with all the Russian organizations to help us better match the businesses, the Singapore MedTechs and the Russian companies that were present today. So thanks. We're looking forward to working with you again soon.
Thank you. Thanks, everyone.
Thank you very much.
Everyone.
Thanks, everyone.
Have a good weekend. Cheers.
Bye.
Bye.
Bye-bye.